This is a first. We have Mohave College. Almost said it, didn't I? Almost, didn't I? Huh? We have Mohave College in the room, and no James. I don't think that's ever happened.
Wow.
I know.
He'll be missing out.
No. So welcome, ladies. We have Dani Walker and Tonya Wade in place of James. And they're both with the dental program, dental hygiene program.
Dental hygiene and dental assisting program. So it's the dental programs.
Programs.
At Mohave College.
At Mohave College. And in Bullhead City.
In Bullhead City.
We don't, the college doesn't offer dental in Havasu or Kingman, do they?
No.
They do not.
Or the Strip?
No.
No, just Bullhead.
Just Bullhead.
How cool is that?
Right.
We're privileged. But you've had the dental program for years. I mean, Tracy's been there 20 years.
2004.
2004, yeah. Yes. So 21 years, yeah.
Mike Kearns came, and Tracy was actually tapped on the shoulder to follow him.
Yeah.
So, from out of state, and they came and he set up the dental program, the dental hygiene program, and Tracy, within a year or two, was the director.
Okay. All right. And how come Tracy didn't show up today?
She's on her way to Nebraska.
Oh, what's in Nebraska?
A conference.
Oh, gonna make her smarter.
Oh, yeah.
Yeah. I always loved conferences because in the fire department, when I would go, I'd steal stuff. You know, what's some other department doing that? I'm not doing that. I want to steal.
It's good.
Yeah.
Good collaboration.
Well, okay. I was a thief. You know, you call it good collaboration. Oh, okay. Yeah, well, you know,
it's
whatever.
the PC way.
But, yeah, the PC word, yeah. Technically, I learned this and borrowed it. Yeah. So let's talk about the dental assistant program.
Okay.
That's your side.
That's my side.
And what makes the assistant, how's the assistant program work?
Well, our program itself, due to workforce demand,
Right.
we used to be a one-semester program, but the workforce has said we need to get a lot more assistants out there because it's a very transitional kind of job.
Okay.
So, used to be one semester, and now it is it used to be 2 semesters, sorry. Now it's a 1 semester.
Okay.
So we start classes, or we just started in August, and we will graduate a class of hopefully 17 students this December.
Okay.
They pretty much have the same 2-semester course load, now kind of condensed to 1 semester.
Whoa, that's a lot of work.
I like to call it the dental assisting boot camp now. Get them in, get them out.
Yeah, they show up at 6 and they go home at 9 o'clock at night. Yeah.
We start at 1, end at 7.
Yeah, okay.
You know.
Wow. But it is a long day and a lot to learn.
It sure is.
Probably one of the toughest parts that I would think would be the tools. You know?
Yes.
All the tools that the dentists use.
There are a lot of different instruments. We call them instruments, actually. But
I like the word tool.
I know. But, we do a lot of, giving them the basics in dental assisting. Every doctor likes to train their employees.
Sure,
for
their way.
needs.
Yeah.
So we really take it to the basics, give them an idea of why they're being asked to perform a certain duty.
Because I would imagine a doctor likes them laid out on his little table differently.
For sure.
Right.
So dental assistants really have to anticipate their doctor's needs.
Yeah.
And to be able to flow really well with a doctor, you need to be able to know what you're doing and what their procedures are and what they're going to need next.
Are they in the mouth or are they just outside helping the dentist?
We are everywhere.
Okay.
We're in the mouth. Sometimes we have our own special duties that we need to do.
Okay.
Dental assistants take radiographs. They actually have to go through the program and graduate and get a certificate through the Dental Assisting National Board.
Oh, okay.
To be legal to take radiographs.
All right.
Same with the dental hygiene students.
And so how long have you been teaching this?
I have been teaching this for 14 years.
Oh, you're a rookie.
I'm a rookie.
Okay.
Yeah.
14 years.
Yeah.
And you're cranking out 17 each semester?
Well, that's our plan. This is our first class where we've accepted, or not accepted, this is our first class that we have had 17 students on their way. Last semester we had 16.
Okay.
And 12 of them graduated.
All right.
So
17 is a good number.
It's a good number.
And you'd like to see all 17 graduate.
Well, yeah, for sure.
And you have 17 doctor's offices, Colin, saying, are they done yet?
Well, yes, we have Havasu and Bullhead and Kingman that we try to satisfy and get them out there into their offices.
Are some of your students traveling from the other two towns?
They are. We have like 3 assistants right now from Kingman.
Okay.
And I believe maybe 3 from Havasu, and they have to travel in Monday through Thursday from 1 to 7.
They don't get to live in your dorms, do they?
They don't. No, unfortunately.
I call them dorms. I know they're not dorms.
Well, we think they are too, but
yeah. I saw somebody put on Facebook something about they were just recently remembering the college being trailer tech, and now they have dorms. And how much it's grown in the last 15 years.
Amazing.
Yeah,
for sure.
Well, you've been there 14, so you've seen it all grow.
I've seen a lot of growth.
Yeah.
Yeah.
I mean, the buildings that thank God for our Legacy Coalition.
Oh, no kidding.
The Legacy Fund that's built 2 buildings, I believe.
They have. They built the building we're in. That was the first building they built. The
dental program, and then now the nursing program.
Yeah.
It's amazing.
And
they do have nursing, though, in all 4 communities.
I believe they do.
Yeah. Because I only know that because when my wife graduated from the nursing, then it was MCC. She was number 1 all 4 campuses, all 4 semesters.
Wow.
Oh yeah, she's a big shot. Yeah.
We're hoping eventually to get dental assisting onto the other campuses. This is kind of our pilot program this year.
Okay.
To see how well we are organized and how well we can provide for the community.
And do you have other people under you that are teaching it?
I have 2. I have 3 other teachers right now.
Okay.
So, yeah, I'm considered the lead, and I have 3 other people, and one that I'm specifically trying to train up to take over teaching some of the classes and everything.
Oh, okay.
Yeah.
So then you're hoping maybe that person goes to Havasu or Kingman and clones it?
Yeah, definitely. Or I can leave it to them in Bullhead since it's built, and I can move on to different places, hopefully, and reach out and see if I can get something going there.
Oh, okay. So you would like Kingman or Havasu?
I wouldn't like the travel, but I wouldn't mind the change.
Yeah.
Right.
Just convince your family we're moving to Kingman.
Yeah.
Yeah.
Sure.
It's cooler.
It is.
I know.
For sure.
It's higher.
It is.
But Havasu has a Red Robin.
That's
so,
true. That's right.
You got to look at all the benefits and a big lake.
That's true too.
Are you an outdoors person?
I am.
Oh, then you might like the lake.
I do love the lake a lot.
If you talk to Ryan Fruworth, he'll tell you there's like 14 trails in Kingman and you can hike.
I am an off-roader too, so I like all kinds of outdoorsy kind of stuff.
Are you one of those people that goes around and gets these little bottles and searches them out?
No.
They have a name for them.
The Geo Hunter?
Yeah.
Oh, no. I've never even actually heard of that. So.
Oh, it's huge.
Okay.
Yeah, because I just had a friend.
Geocache.
That's what it is. Yeah, because I just had a friend, her and her husband do it, and she put on Facebook that she was looking for prescription bottles. Well, I just happened to have a ton of prescription bottles, so I took them to her the other day, and she was like thrilled.
Oh.
I said, they're just old. I take all the labels off, and she was like, well, these are perfect. This is great. So they have a Jeep, and that's what they do.
I have a Bronco. So,
yeah?
Yeah.
You have an old Bronco or a new one?
A new one.
A new one.
Well, we have a 78 also, so that's kind of fun. But
I'll bet.
We don't go rock climbing with that one. It just sits in the garage.
My wife and I yesterday, we'd take the cotton candy machine for Kiwanis and go put it in our storage. And we're on our way home, and we have a new Bronco in front of us going up from Walmart up to the Parkway. And she says, I don't like those new Broncos. I said, well, they're tiny. I said, they don't remind you of the old Bronco. And sure enough, we turn on the next road. It's Arcadia. And we're going. I said, there's an old Bronco coming towards us. I'm like, wow, that's weird. Because you don't see a lot of the old ones.
No, that's true.
Although Bullhead Fire owns one.
Oh, really?
Yeah.
That's cool.
I have the fire chief in here in a few weeks. So I'm going to have to ask him that. That's got to be their oldest vehicle they have.
Probably.
Yeah. It used to be the assistant chiefs 100 years ago, back in the day. And we're talking about the dental assistant program. And are there prerequisites to get into the program?
There are no prerequisites for the dental assisting program.
Okay. Do they have to pass a test or anything to get in?
Oh, no, not
Just
really.
a high school diploma?
They need a high school diploma or a GED. They
Okay.
also need to be able to Pass a basic math exam, I think. if
Okay.
that.
All right.
Yeah.
Is there a lot of math in dental?
No, not really. We have to know.
You also
what
have to be able to
yeah.
change the oil in a 56 Chevy, but that doesn't happen in the dentist office. You know?
No, need to count to 32 because that's the amount of teeth we have. No.
Yeah. And they're all numbered, huh?
They are. Yeah. So,
I've never looked in the mirror. Are there little numbers on my teeth?
well, no, they're just kind of, it's how we identify them in the world.
Oh, okay.
Yeah.
All right. Uppers and lowers? Or just all with one number?
They go through our standard system is like 1 through 32.
Okay.
So, yeah.
And then learning the instruments.
Yes,
Not
learning
tools.
the instruments. That's a lot of interesting. There's a lot of different instruments. See, you almost got me.
Yeah.
A lot of different instruments out there.
Well, I can imagine there's also a way to hand it to the doctor. That's
It is, yeah.
Because when he takes it, he's got to put it right in someone's mouth.
Right.
And so there's a right way to do that and a wrong way, huh?
There is. Yeah, very specific in how you can hand and grasp the instrument out of the doctor's hands.
Well, that's right, because then he's going to give it back to you and then say,
Right.
now give me this. And,
Right.
Yeah.
The
So-
instruments are razor blade sharp.
Move that up just a little closer to your mouth.
The instruments are razor blade sharp.
Oh.
So.
Yeah.
And I kind of knew that because I've been on the receiving end of some of those instruments in my life. I think everyone that's a listener is going, yeah, me too.
Oh, yeah.
But yeah, they are a little pointed and sharp, huh?
Yeah, they have to be really careful for sure.
Yeah. Okay. A serious question. 8% drop in medical. Let's see. I'm reading it on my phone. Let me read it here. 8% drop in medium typical for this time of year? I don't know. Did you say 8% drop?
I don't think I gave a percentage, but I'm not sure what that's referring to.
I don't know. Maybe they're figuring between the amount of students that you see.
Oh, possibly.
Yeah.
Right.
But how many can you take on the high side?
We have room for 18.
Okay.
We did start the class off with 18 this semester, and then something came up with financial aid, so one of the students had to drop.
Okay.
Financial aid covers the entire cost of the dental assisting program, so that's kind of nice. Students don't
Do
have
we
to
do we
return
want to
the
tell
program.
anybody what the price of the program is?
Right off the top of my head, I don't know what the price of the program
Yeah,
is.
because you're just in charge of teaching it. You know,
That's right.
You don't have
Yeah.
to deal with the pennies and
Right.
dollars and all that good
I
stuff.
want to give them the knowledge and
Right.
yeah, so
But so unfortunately, they get in and they find out that that scholarship or something didn't come through.
true, right? And or they get in and they decide on that first or second day that, ooh, maybe this is not what I want to do.
Right.
This class that I have really seems like they're all fully engaged. I'm super excited. I
That's
think
good.
that they might be the one. Give
Coming
the full
from
set.
coming from Bullhead Fire, I remember one of our firefighters had graduated from the law enforcement academy. Got to the police department, and after like 1 week of field training, said, "This isn't going to be for me," and left and became a firefighter.
Yeah.
And then another gentleman who's still there, both of them are still Bullhead Fire. He worked in the field for the police department for about 3 or 4 years, and then said, "I think I want to be a firefighter," and he tested and became a firefighter.
That's great.
So I can understand some people starting your program and going, this isn't what I want to do.
Yeah, for sure. Sometimes they use the dental assisting program as a step to the hygiene program.
Okay.
Hygiene is a little more rigor to get in. They have prerequisites. So the dental assistants are able to put their toe in the water.
Right.
Basically, get into the program just a little bit easier by going through the assisting program first.
Because they've learned so much to begin with.
Right.
Okay.
Right. And there's a couple classes that I teach that have dental hygiene and dental assisting in them. So it kind of gives them an easier pathway to get from one to the other.
Is that because the assistant has to know when to hand off to a hygienist, basically?
No, not necessarily.
Oh, okay.
The two classes that are combined are just like the dental radiography, because both hygienists and assistants need to know how to take x-rays and be safe and
Right.
why. And then the other one is a basic overview of like the materials that we use in the dental office.
Okay.
And hygienists kind of need to know that so that they can help educate their patients about treatment and stuff that
Okay.
they might be needing to.
How many different instruments does a doctor usually have that the assistants hand into him?
Oh gosh, that's just varies depending on the procedure that we're doing. So, one procedure in particular, a basic filling could probably include up to 10 or 15 different instruments.
Really?
Yeah.
And then if it was something major, like maybe a tooth removal or something, or surgery of some kind?
Then it could go from there. Yeah. So a tooth removal is usually pretty easy. That's like 3 or 4 instruments.
Okay.
And then a surgical extraction could definitely give you a whole open.
Surgical extraction.
Yeah.
That doesn't even sound like anything I want to know about.
Well, yeah. Sometimes they turn into it though. So
Yeah.
surprise.
So then it's a whole new tool set.
It's additions.
And all the tools that the doctor uses, the dentist, and the assistant is handing him has to be sterilized.
Yes, for sure.
Are they wrapped or are they just sterilized and placed?
So we have autoclaves in the dental.
Who?
Autoclaves, they're sterile or steam sterilizers.
Okay.
Big boxes that have steam and
Right.
heat. And we individually wrap our instruments to whatever procedure we're doing. And we'll put them into the sterilizers. And yes, every single patient receives, obviously, sterilized instruments.
Okay. Yeah. Because you don't want to pass anything from one to the other.
No, we're big on infection control in dental.
And today we see when we go in the dentist's office, everyone's wearing a mask.
Yes.
I mean, years ago, we didn't see that.
Right.
I don't think it was COVID that started that. I just think that it was probably requirements, number one. Are they required to wear a mask?
Yes.
They are, okay.
Yes. So in infection control, the aerosols that we create in dentistry can
Okay.
spread and get everywhere. So we
Okay.
protect ourselves by wearing masks. We are seeing 10 to 15 patients a day. So, we just got to protect ourselves and do our best to protect the public, not spreading things.
So a text question that came in was, do you see on TV these whitening kits that people can buy? You have the brightest teeth in town, Do they work? Are they good? Or are they bad?
Go ahead.
They're both looking at each other like, who wants to answer this question?
So, yeah, you could buy, it's hydrogen peroxide most of the time, and that's what you can generally purchase over the counter. And
Okay.
it is the same product, it's just at a different concentration. So if you come and actually if you go to the dentist's office and buy their kit, I'm not going to say a couple brand names,
Right.
but if you buy there, it's just a higher concentrate of hydrogen peroxide. And then there's one where there's light, but recent research is actually showing that the light really isn't significant in the whitening of the teeth.
Okay. Because my dentist used to have the light that they would roll over your teeth. They don't do that anymore.
The latest research is not supporting
That it works.
that it enhances anything.
All right. But it's interesting that a dentist was wanting to do that, thinking that it did work, and it was the latest, greatest, and then they can get rid of it when they find out that it
Well,
wasn't.
I do want to say this, though. It absolutely still whitens your teeth. It's just the light was kind of gimmicky.
Oh, okay.
Just a bit gimmicky.
So let's talk about dental hygienist. This is your area.
Yes.
And the biggest difference, what's the biggest role of the hygienist? I know, are they the one who puts me in the chair and...
We are preventative specialists.
Ooh.
So we actually, we are the ones that will, we generally take a patient back. We do the assessments. We evaluate and give a periodontal diagnosis.
Okay.
And then we determine, and we work alongside with a dentist, so we do not operate on our own, although we can be in partnership with a dentist, which I'll get into maybe in a minute. But then we'll take the patient back, we'll do the assessments, check in, we go over the medical dental history, we do the periodontal charting, and then we determine what type of cleaning the patient is going to be needing.
Okay, because there's different kinds?
There's different kinds. So if you just think about it, if you've got an 18-year-old coming in, they haven't collected much of anything on their teeth. It's just maybe the food that they just come in with. That'll take 20 minutes to clean, 20 to 30 minutes to clean. Somebody who comes in who hasn't been to the dentist in 25 years, which we see all the time at our dental clinic. Oh, yeah. That will, take a little bit longer. It's called a SRD, scaling and root debridement. So they might need that. It's deeper pocketing, bone loss, complicated sometimes with systemic diseases. So that may take a little bit longer to clean.
So they're doing the cleaning, the x-rays for the most part?
We do cleanings, we do x-rays, we do, what else do we do?
Patient education.
Patient education's big. Oh, I've got it right here.
Okay.
Periodontal therapy.
I was going to say, you sent me a whole page of notes.
And exams. Yeah, I just need to look down.
When we talk about the hygienist, they might have already been the assistant, so they can do everything the assistant can do, correct?
Well, the ones that have been assistants. Now, dental hygienists, it's a different wheelhouse. So they don't know if somebody has not been a dental assistant, they may not have a clue what they do.
Okay.
So it's kind of a standalone. It's not necessary to be an assistant to be a dental hygienist.
But they're going to know all the
They'll know the language.
They'll know the language. They'll be able to hand it the correct instrument when he calls for it or she calls it.
Dental hygienists rarely will hand the instrument. They don't work directly, like the dentist does not sit across from them.
Oh, okay.
Generally. They work alone. So they usually have their own operatory. The dentist comes in for the exam and leaves. So,
okay.
So we work alone.
If the dentist comes in and looks at the exam, looks at the x-rays, and he goes, look, you have one cavity. Let's fill that right now. Does that individual still stay and assist him with that?
So sometimes.
Okay.
But usually they'll move him to another room because the dentists still have a restorative room. I mean, that's what I've seen where I've worked.
Oh, okay.
Is that true?
Yes, usually. Or we'll reschedule for another time, depending on what the schedule looks like of the day.
Right.
Because
I'm going to say a dentist is going to want his assistant, not a dental hygienist that isn't
okay.
helping him on it.
He wants his assistant.
He wants his assistant.
That knows his priorities and everything.
Yeah, because anticipating what instrument goes in that mouth next, like when they're excavating decay, they're going in.
Excavating decay?
Excavating decay. That's what they call
they
it.
do. That just means going in and digging out the soft stuff.
I call it brushing my teeth. I don't know.
A little difference.
So they'll need the excavating instrument. So the assistant will have that ready to go as he goes in, so he doesn't have to ask for it.
So
they're really strong. It's a strong partnership for them.
Okay. So a question, and I don't know which one of you can answer it. When you're doing these home kits to clean your teeth, do they damage your teeth at all? I mean, do you have to worry about that? Maybe it's hurting my enamel or...
And so you're talking about the whitening kits?
Yeah.
Okay, so the whitening kits, does it damage your teeth? It can make them more sensitive.
Okay.
There's two school of thoughts on that. The manufacturer inserts actually say they don't damage the teeth.
And she's smiling when she says that.
And so you wouldn't want to, I mean, you wouldn't want to over whiten your teeth. If the sensitivity is real, and sometimes you can have fluoride varnish painted on your teeth and it'll lessen the sensitivity. But sometimes you can have permanent sensitivity from using too much of the product.
Okay. So read the directions.
Read the directions.
And if you've been trusting your mouth to the same dentist, ask them,
Absolutely.
I mean, why would you go on and do something like that without having... I mean, my guy's Ted Jennings. I can text him and ask him questions, Yeah. I don't know, for years now I've just had the idea that I don't want anyone working on my body that I can't text. And so I have all their numbers in my phone, but still, even if you have to call their office and you say, so-and-so is my dentist, like Jenny's and Larson's, there's like 25 dentists there, but, you have to say, so-and-so is my dentist and I'm going to do this or I want to do this and see what they think before you start going and buying that stuff.
For sure.
Yeah, absolutely. Get opinions. Whitening's popular. People come into the dental hygiene clinic and then, that's what they're interested in. And, it's kind of got to start with the foundation first, though. Let's get you in health and we'll look into
Let's
the
get them
whitening
clean
product.
first.
Yes.
Yeah. Well, and you can have your dentist office safely whiten your teeth, right?
Yes, absolutely.
Okay.
Not all dentist offices offer that, but several around here I know that do.
Okay. So ask your dentist office.
Ask your dentist office.
Let's talk about the gum.
Okay.
Because one of the things that I notice, like one time I'll go and they'll, measure the gums?
So that is part of the periodontal chart. So what you're talking about is probe depths. So that evaluates, we're looking for pockets, how deep that probe will go in, and it'll have a measurement on it.
And usually there's two people there, because one's doing it in my mouth and yelling out 4, 3, 7, 1, whatever, and somebody else is over there like charting it.
Well, that would be great if that happened all the time, but a lot of times the dental hygienist actually probes and types it in the computer as well.
If they're lucky to have an assistant.
Yeah, an assistant sometimes will.
Right.
Yeah.
Yeah,
depends on the
awesome.
office. Yeah.
And that's another thing that the assistant does.
So when they're probing and they're measuring the depth, what does that mean to the patient?
Okay, so the periodontal health. So we're looking for inflammation in the periodontium. So it starts, of course, generally it starts with a gingival inflammation. So you'll get a deeper pocket depth if you just think of the gingiva just inflamed in coming up. But that also starts to destroy the bone that actually surrounds and holds the tooth in place.
Oh.
So, and then when we get into bone loss, we're talking about periodontal disease.
Right. And then you're usually referred to somebody that's a specialist in that.
Well, not necessarily. It depends on the severity of it. It would never be a bad idea to see your periodontist if you have been evaluated and diagnosed with periodontal disease. Gingivitis is also a category of periodontal disease which you can actually reverse. So gingivitis is just in the tissues, soft tissues.
Okay.
Periodontal disease is when you start to get bone loss. When you start to get bone loss, you could just have an SRD and scaling and root debridement. We divide your mouth into quarters, so in 4 parts. We'll do two quads at a cleaning is generally what takes place. And we can sometimes stop the advancing of the periodontal disease with a patient, in collaboration with the patient.
Okay. Because it's going to require more visits and
so
different type of treatment at the dentist's office.
A different treatment than, let's say, an 18-year-old who just has, localized gingivitis.
Okay.
So an SRD is somebody who has deeper pockets, bone loss, maybe tooth mobility because the bone has shrunk away from the tooth, from supporting the tooth.
And the reason I brought up the gums is because the gums are just as important as your teeth. Mm-hmm. And people probably sometimes don't brush their gums. They just brush the darn teeth, or maybe just the tops of the teeth, and you're not getting down in.
So the bristles on the brush typically only reach within 1 to 2 millimeters deep underneath the gum tissue.
Right.
And as you were telling me, that the average probe depth is 2s, 3s. That is a healthy depth for that probe to be reading.
Oh, okay.
When you get to 4, that's generally a sign of gingivitis. So the gingival...
That's a yellow light going off.
That's the yellow light going off.
Anything deeper than that is a red light going on.
That's right.
Okay.
When you get to 5, there's bone loss typically. Not every time, but typically there's bone loss there.
And what can we as the American public patients do to prevent that?
So remove the pathogenic bacteria at least twice a day. Okay, because that is what is causing the destruction.
That's the easy way to say it. Brush your darn teeth.
Brush your teeth.
And floss.
Yeah,
floss.
And floss.
We're talking about pockets as you're probing. So, it's a nice, dark, warm, moist place for bacteria to get in and populate. So you need, when you go to the dental hygienist, they'll clean that out because you can't, the normal person can't just reach in there and clean that out.
Right.
So
we don't have the instruments at home.
Right. So dental hygienists have the instruments and the power instruments, and they remove all that calculus buildup. They remove the home for this pathogenic bacteria.
Okay.
So then you can go home and or a person can go home and brush their teeth twice a day and keep it at bay.
Right.
So
that
keep
works.
the biofilm down, which keeps the bacteria population down.
Years ago, Jennings and Larson's used to give out T-shirts to all the kids. When I taught fire and life safety in the classrooms, I could walk into a classroom and there'd be 3 kids wearing a Jennings and Larson T-shirt. Some dentists probably like doing kids, some probably don't.
Yeah.
Because the mouth is smaller, the patient is not
Wiggly.
as calm, be wiggling around in the chair while you're trying to do stuff. How do you teach that for the dental hygienist?
So they actually have requirements between the age of 1 and 19, so they could take in any of that age. We do have children coming in. We used to do Give Kids a Smile, but the corporate offices have come into town and kind of was in competition with us. And so they've pretty much taken it over.
Okay.
If the opportunity comes back, we'll start doing it again. But we do offer sealants. I do want to put that out there. Our dental hygienists are trained, so
Explain
they know
what
how
a sealant
A
is.
sealant is protective. It's not a filling, but it actually coats a healthy tooth, like an occlusal surface or a buccal surface, which would be just a little pit in the tooth that's natural forming, that's there,
Okay.
and it'll protect it from decay going into that little spot.
All right. Okay. A lot to know.
It's a lot to know.
There's a lot
It is.
She's using some pretty technical terms, but
I know.
so if you are on that chewing surface,
sorry.
that's okay. On the chewing surface is the occlusal, and where your back teeth have all those grooves in it, we kind of paint a little coating in there that keeps the germs from getting down into those little crevices. And that's what a sealant does, is it prevents the bacteria from growing and causing decay.
Okay. Should people ask for a sealant every time?
No.
No?
It's generally for children.
Oh, okay.
Yeah, it's generally just for children. It's preventative.
That's because it's hard to get a kid to brush their teeth twice a day.
That's part of it. And
Let's face it. Yeah.
in the diet.
Yeah.
Well, yeah, and what they eat. We won't go into that list. Let's talk about the public coming in getting dental work.
Oh, awesome. So here in Bullhead City, we have a dental hygiene clinic.
Right.
So I do want to make it clear that we don't have dentists here that are doing restorative work, which
Okay.
means fillings or extractions, or we don't have a dentist there. So we don't do that.
Okay.
However, we do, like, if you are at a dental office, we partner with dentists in our community that will actually send patients that maybe can't afford the procedure that they're recommending, which is usually 4 quads of SRD, which is the scaling and root debridement, where local anesthesia is given and you are numb, and then
Right.
then the dental hygienist gives you the anesthesia, and then they actually go in and clean the teeth.
I think every patient knows the word Novocaine from going to the dentist.
Yeah, so the Novocaine, the general public generally say that, but it's usually lidocaine 2%, and napivacaine is what we have in the clinic. But they'll come in. So we partner with the dentist. We have a referral program. So
Right.
if dentists out there are listening, we have a referral program.
Every dentist I know has his fingers in someone's mouth right now. He's not listening to the radio.
Well,
Well, it's almost lunch.
but if you contact our office, we can send you over a form, and this would it just fast tracks the patient to the dental
Okay.
hygienist. So can I give that phone number?
Sure, of course.
Okay, this is 928-704-5555. 7788.
And that's right into your office at the
That's
college.
right to our dental clinic.
Okay.
Yes.
And they can set up an appointment there?
They can set up an appointment. Our students need patients.
Right.
They work on real people that call in and they come in. Now, I do want to put out there that it is a little more time consuming than going to a private practice.
Because the students are learning as they go.
Absolutely.
And I'm assuming that you have an instructor standing there?
We have 2 instructors at all times.
Is that what Steve
in
Smith does for you?
Steve Smith is my pal. He
was my pal first.
Yeah, local anesthesia. Actually, we actually sometimes have a kayak trip that we put together at the end of their graduation and take all the students.
You and Steve?
Steve and I.
Oh, okay.
And Tonya's gone.
Yeah.
It's open to the instructors.
You know, Steve hiked that from like San Diego to Alaska or something.
Oh, yeah.
Yeah. He's a fruitcake. He just do all that stuff. Him and his wife just celebrated their anniversary the other day. She put it on Facebook. Oh, that shocked me. Yeah. But I've known Steve for years when he was a lieutenant at the police department.
Oh, yeah.
Yeah.
He's an awesome man.
And we can mention that he and Dr.
Larson
ride a tandem bike from Bullhead City to Kingman
Oh, yeah.
each week.
Yes.
They do it every week, spend the night, then they work in their office in Kingman, and then they ride the bike home.
Yep.
Yeah.
Through Oatman, through the back way.
Yeah, he does. He is Mr. Adventure.
I know. Both of them.
Trailblazer.
Yeah. That's crazy. Give that phone number again in case somebody didn't have a chance to write it down.
Okay, it is area code 928-704-7788.
Okay. They can call and make an appointment, go in and get a teeth cleaning. That will take a little bit long. Do they pay for that?
So, yes, the fees are, for the dental exam and x-rays, it's generally $30. However, if you're a Mohave College student, it is free. And if you are a faculty member there or teach, you will get a discounted rate.
Oh, okay. All right. So we're all trying to learn Mohave College because a month ago they changed the name of the building.
Oh, yeah.
Of the whole program.
Rebranded it.
Rebranded it. That sounds like something that came from James. We're rebranding the college.
It did.
Yeah. All right. Well, So Mohave College, Bullhead City, Kingman, Havasu, and the Colorado Strip. But these classes are only available in Bullhead City.
Yes.
Yeah. And you can also get your teeth cleaned there as the public for only $30, which is pretty reasonable, I think.
Yes, for your basic cleaning.
Yeah.
So with the exam and x-rays, that's $30 alone.
Okay.
So the cleaning would be an additional.
Oh,
$30.
okay. All right.
But the most important, if you're interested in being a patient, the most important takeaway from what I just said, you will pay with time what you save in money.
Yeah.
So it will be.
Because it takes a little bit longer. You have to be patient
It's
as a
usually
patient.
2 appointments,
Okay.
and they're about 3.5 hours long each.
All right. Ladies, thank you so much. Great information.
Thank you.
Thank you.
And the phone number again?
It is 928-704-7788.
All right. Call if you have questions. Call if you want to send someone through one of the 2 programs and be working in a dentist office. Or call if you want your teeth cleaned. It's that simple.